Welcome to the webinar on understanding the PPE world. I'm Jerry Hafer. I represent AMAC and the AMAC Foundation, and I'm happy to be with you today. We're going to be exploring an interesting topic, a topic that within the past 6 months has gotten to be a part of our everyday life. But let me talk a little bit about AMAC and the AMAC Foundation first before we start. AMAC is the Association of Mature American Citizens. We are the conservative alternative. We represent the interest of seniors in Washington. We have a strong presence in the nation's capital where we watch out for seniors in terms of pending legislation, and we basically take the input from our members, and we have over 2 million members, 2.2 million members right now, growing rapidly. We take the interest and the needs of our members and convey them to representatives in Washington and kind of watch over legislative actions to make sure that senior needs are being addressed correctly. We have offices in New York, Florida, New Mexico, and Kentucky, plus a presence nationwide, actually. AMAC has volunteer chapters across the country, and we're very active in local affairs as well, representing residents with their elected representatives. So we're very active in that regard. And as I said, growing very rapidly. We're, adding, probably in the neighborhood of 1,000 or 2,000 members every week. So it's growing rapidly, and it's an exciting time to be with AMAC because of the ground that we're covering. The AMAC Foundation is the public benefit arm of AMAC. We are a 501c3. Registered in the state of Florida. And our mission is a very simple mission. It's to support and educate America's seniors. And we do that in a number of ways. For example, we operate several information-packed websites. The amacfoundation.org website is our main website, and that contains all the information about the foundation. It includes an events calendar of all the upcoming events that we have. And it also has a lot of resources in terms of veteran support, senior support. And every Monday morning we publish a blog that addresses a topic of interest to seniors. So that's our main site. We also operate 2 topical sites. The socialsecurity.report.org is another information-packed website that has basically all you need to know about Social Security. And we channel breaking news about Social Security so that people can stay abreast of what's happening in the world of Social Security. Every day there are 4 or 5 articles about things that are changing in Social Security and retirement issues as well, I should say. And there's a lot of archival information on the site. The Social Security trustees reports, for example, are stored there. And we also have a number of handy tools and calculators that people can use to help plan their retirement. So it's a very active website. It gets a lot of attention, a lot of hits. So it's a very active website. We also have a third website, MedicareReport.org. And a Medicare.org report is similar to the Social Security Report.org, except that it's dedicated to the world of Medicare and healthcare in general. And I neglected to introduce my accomplice, Eileen Cook. Eileen Cook maintains the Medicare Report website. She's AMAC's, I would say, Medicare and healthcare guru and researcher, primary researcher, but she's also my right arm in what the AMAC Foundation does. So the Medicare report side, as I said, is similar to Social Security. It has background information about Medicare and channels the breaking news about what's happening in the world of Medicare. So that's one of the primary ways that we operate. We also run a seminar series. Up until the pandemic hit us back in the beginning of the year, we were doing 2 to 3 seminars on average each month on topics of interest to seniors, whether it's Social Security related, healthcare related, senior fraud related. We even do some technology sessions about cutting the cord with your cable company is a very popular one that we operate quite frequently. Understanding the smart home technologies. So we run seminars, as I said, 2 to 3 per month. But since the beginning of the year with the pandemic situation, we suspended that for a time being. And then as it became obvious that the pandemic will be with us for a while, we elected to get into the virtual seminar world with Zoom. And we've started doing that now. We're still relatively new in that area, but we have a bunch planned for the coming months just to stay engaged with our constituency. So websites and seminars are 2 of the ways that we operate on behalf of seniors. And the third, our flagship program really is the Social Security Advisory Service. We have 5 accredited advisors on staff at the foundation who handle questions from the public about Social Security. If you've ever looked at Social Security structurally, you probably appreciate when I say that it's sort of complex. There are over 2,700 rules and regulations that govern how you apply for Social Security. And then there are probably 100,000 pages of documentation that either further explain those rules or countermand those rules, unfortunately. And so people get confused when they think about Social Security. And we have, as I said, a staff of 5 accredited advisors that have been trained and accredited to provide researched and credible information to someone that just has a question about Social Security. They call or email us and say, I don't understand this, please explain it, or how does this apply to me? And we take those questions and develop a researched answer and publish back to them. And it's a very active program. As I said, it's our flagship program. We handle between 400 and 500 on average inquiries per month. And since we started the program, we've served well over 12,000 people that have had questions, and we've helped them understand how Social Security applies to their situation. That's basically a snapshot of the foundation. I would welcome you to take a look at our website, amacfoundation.org, and check out the things that we do. And if you're interested in Social Security and Medicare, of course, take a look at those sites, socialsecurity.org and medicarereport.org. And again, as I said, that's pretty much the snapshot of the foundation. Did I miss anything, Eileen? Okay, good.
No, you did not.
I usually miss something along the way, but that's one of Eileen's responsibilities, is to keep me under control. So today's webinar, we're going to be talking about the fantastic world of personal protective equipment, PPE, something that until probably March of this year, people had maybe a glancing understanding of what PPE is. It pertained to professional kind of people, and all of a sudden it becomes a part of our everyday world. And so we felt that it would be good to put this webinar together and explain basically what PPE is, what PPE equipment is. Well, that's redundant, but what the equipment is that's involved in it. And we went to the experts, and the experts, of course, are the VITAS healthcare people. We've had a relationship with VITAS for some time now. We've done a number of seminars with them, and we value the relationship that we have with them. They do such an excellent job for us in terms of explaining complex things to our constituency. So we appreciate having them here. And on the call today is Christopher Shepard. Christopher is the volunteer service manager for Lake and Sumter counties for VITAS, and has been a kind of a godsend to us in terms of helping us organize efforts like this one. He's been a resident of Florida for 14 years, so he knows his way around, knows his way around the territory. And I'll ask him to say a few words about VITAS if he'd like. And we also have with us Gloria Puerto. And Gloria is unfortunately for her, she's a last minute substitute this morning. So,
I just received an email. I'm sorry to interrupt. I just received an email from Chantel. She's having issues connecting, so I'm going to resend the link to her. Half of Eustace apparently is out of energy.
okay.
Yes,
So
we were
they have a
struck by
power
lightning.
issues.
Yeah,
They
we
have a
were
power
struck by
issues.
lightning in our office.
Yeah. So I'm gonna resend the link, and I will cross fingers she can make it. But go ahead, Christopher.
Okay.
Talk about.
I'm sorry to interrupt you, Gloria. Yes, our Eustace office got struck by lightning, so that's we've been dealing with that for a few hours. So that's a little crazy. But VITAS is the nation's oldest and largest hospice provider. We're new to Lake and Sumter County, relatively new. We started serving Lake and Sumter County in January of 2018 by invitation. Florida has a unique system for hospice companies. We don't just show up and say, we're here to serve you. The county governments with the state join together to research their population's needs, ask hospice providers to apply to serve those needs, and then they select one to come on board. So hospice has been a part of this area for some time and done an excellent job, but there were additional needs because of the population growth. Our specialty is helping our patients stay at home, wherever they call home, whether that would be an assisted living or a memory care, or a nursing home, or a private residence. And we are very much delighted to work with AMAC as well, Jerry and Eileen. We enjoy our partnership with you. So with that being said, I'll turn this back over to Gloria. Gloria and I have a lot of fun together because, as you can tell, Gloria's background is of Hispanic descent. She's from Colombia. She has a great story. And I'm a tried and blue Midwesterner. So we have fun playing off of each other. And Gloria tells me that I have permission to explain what she says if she sounds a little bit like the feminine version of Ricky Ricardo. So we just have a good time, and we'll enjoy being together this morning.
Thank you, Christopher. And actually, you know what? One of the things that we learn when we work together doing these presentations in the community is that we are in such a stress, and our line of work generates so much tension, and it's hard to talk about it, and it's hard to bring these topics on live, right? That we decide that as much that we can make people feel comfortable and feel relief of all the stress, we will do it at the same time that you learn. So a little bit of my background is I'm an occupational therapist, like Christopher said. I'm from Colombia. When I came here to the United States 16 years ago, I pursue at the education side of the occupational therapist profession. So I'm been working with the Stanford University. They have a very nice program for community education, and we work with Senior Resource Alliance and Elder Options for different self-management programs like diabetes self-management, like chronic disease self-management, matters of balance, and all that programs that help me to develop good relationships in Orange County and Seminole County with the community. And then a year ago, I was transferred for this territory, Lake and Sumter. So I'm kind of new in this territory, but I'm very excited to be here today. I'm trying to respond, Chantel, at the same time that I'm talking, and I'm kind of not good doing both things at the same time. Today, the presentation is about PPE. Our specialist, it's trying to get into the, so I'm gonna start until she can come in, and obviously if you have any questions, probably she can answer as well. So let me try to share here my screen. And by the way, Gerald, I already know how to go back to you as a host. So whenever you need to go back, I can do it so you can share your screen. So let's start it. Well, understanding the PPE world, especially for healthcare and in everything related with us. But to understand the PPE world, we need to know, and let's see, what I'm trying to move presentation here, take a little bit. Okay, we need to understand what PPE stands for. So it's personal protective equipment. And as you see in the picture, it's very, it depends of everything related with the work, or where you are, in order to know exactly what you need or where you need to be protected and minimize exposure to hazard, like workplace injuries, illness. These injuries and illness may result from the contact with chemical, radiological, physical, electrical, mechanical, and obviously a lot of things around that environment that needs to protect yourself when you are doing that type of job. So when we talk about personal protective equipment, we may include things like gloves, safety glasses, shoes, earplugs, hard hats, respirators, coveralls, vests, full body suits. So all gonna depends of where you are and what do you need to interact with in order to be sure that you are safe in your environment.
So really, you need personal protective equipment just to mow the grass. Is that right, Gloria?
Yeah,
Because you
it
need
is.
earbuds. Yeah,
It is.
okay.
Well, all depends on what tools you are using. So that is the difference. It is very nice that you bring in that up, Christopher, because it's not only the PPE, what you use, but the tools that you use and have to be the right tools in order to reduce that risk. Well, let's talk about the PPE in a healthcare setting. So PPE are various items worn to protect the healthcare worker, but specific for what? For body fluids, infection disease when caring for ill patients. And it's important to remember that all body fluids should be treated as a potential infections agent, even when the patient doesn't have confirmed diagnosis. That's why when you utilize this PPE, has to be since the beginning. It's not like, oh, this patient test positive, so right now we need to use the PPE. No, that's why you will see the precautions of the healthcare workers, even when the patient is not even yet diagnosed. Some basic examples of the PPE can include in the healthcare industry, gloves, gowns, and masks. The type of PPE used can vary based on the level of precautions required. And that's gonna be such as standard and contact, the droplet and airborne infection, isolation precautions, and the procedure for putting on and removing PPE should be tailored to the specific type of PPE. What that means
You know,
is,
Gloria, can I interrupt you here just a minute? I'm so
for
glad you're
sure,
going to talk about this, the procedure for putting on and removing
yes.
PPE, because the mask situation, so many people were wearing them because they're mandated or we believe we should, but I see people drop them and put them back on their face, or they handle them so much, and really maybe we're putting ourselves more at risk than we ever did before if we don't know how to handle them properly. Would you agree?
Totally, and we will talk about that in a little bit. So yes, not only to know what you need to use, but as well what how you manage put it on and removing. So it is very important to understand, and all is based in the environment that you are as well. So now we're gonna see based on the CDC, well, the COVID specific, and we're going to right to the point of the COVID. The COVID PPE healthcare providers. So you see two examples of how people or how healthcare providers are working with or what is required for. So they can use the N95 mask. This is specific or higher respirator, and that's, I'm gonna explain that in a little bit, so you can understand what is the difference and why it's the importance of having that higher level in the healthcare or specific healthcare providers. The goggles, the face shields, one pair of clean, non-sterilized gloves. The gloves are one-time use, and the gown, the isolation gown, it's one-time use. What that means is if someone cough or spill and you get all that in your goggles and you're were coughing or sniffing, and that fluid get into your clothing, so you get contaminated. So that's why you use the gown, because you're gonna get exposed to people that can sniff, they're ill, they're sick. The gloves, do you use it and you threw it away? I see a lot of people using gloves in the grocery stores. The sad part of that is the gloves get all contaminated with not only any type of virus, but bacteria that you can touch your face because you forget that you have the gloves on, and you use the gloves for everything in the store, and then you go into the car and touch everything in your car, and then you probably put your gloves off and leave it there so you can use it next time. Well, that is dangerous. So when people ask me, should I use gloves outside to do my groceries, I will say no, unless that you touch something and you threw it away. So you will use multiple gloves in the grocery store. It's better if you have your hand sanitizer and sanitize your hands when you are finish all your groceries in your car. You put all your groceries in your car, you wash your hands, or use your hand sanitizer, and then you pay, and then you use your hand sanitizer. You bring your own bags from home so you don't have more exposed, and then you bring that bags, your bags that are clean, I'm sorry, and you put all your products, and then when you get out to the car, you do your hands again. So it's a lot of process, but if you see it like that, you can understand why it's not that good at such a good idea to use gloves for that. That's one pair of clean,
Gloria,
non-sterile.
would you recommend using gloves at the gasoline pump? I've heard different things about that.
Again, is how do you use it? You can use it, but you have to throw it away. You cannot reuse your gloves. If you are using gloves in the gas station, you should use that and throw it away. Not keep it in your car, not bring in, and I don't see that it is much better if you just keep yourself, unless that you have like any allergies for hand sanitizers, or but again, the gloves have to be one pair per use. And another things that you see here in this graphic is the face mask that can be the surgical one that is good. Now, if you see the face shields or goggles and the mask, I'm seeing a lot of people only use the face shields. The face shields is for fluids. If someone sneezes, all that fluid, right, is protected by the shield. However, the droplets, the air bonds, everything that is by air, when you talk, when you laugh, when you scream, when you even open your mouth, is exposed. So if you're using only your face shield and you're not using the mask, you are only protected if someone is sneezing your face. And the probability of someone is sneezing your face are kind of limited unless that you are working, right, in a healthcare environment. So it is important if you want to still use your face shield that you use the mask. They have to be together, not one to replace other. So let's talk about the COVID-19 and face mask, because it's important to understand why we talk about N95 or FFP2, and FFP2 is known in Europe. So that's the N95 for America and FFP2 for Europe. But why we just recommend the or do not use the N95, because the healthcare workers need it the most, because they are exposed the most, because they are having people that are sick, because the filters that this mask have can protect you more in percentage, over 95% of the airborne particles and the droplets that the virus produce. So the surgical mask has one way to protect, to capture that particles and droplets from the people that wear it. So what are you actually doing is protect others if you're sick. So if you have any type of virus and you want to prevent someone to get sick, you use that mask. So surgical masks will help to protect others, that, you know, reduce the amount. And I'm going to show a graphic later in the presentation about that. The N95 is two-way protection, which means the filters, and they prevent that to get into yourself. The bandana, the do-it-yourself type of mask, that will protect both of them, but just the material that you use for that do-it-yourself mask, the ones that you do or the ones that you buy, is going to be the difference. So let me talk about that material, right? So the face mask will be the percentage, or how you're going to be protected, is going to be based on the type of material that you use and the layers that you use. So in this graphic, you will see the materials that we are talking about. And this is in a study, by the way, done by the Nebraska Medicine and Health and the Nebraska Health Centers. And I put the link there if someone wants to.
I'm sorry, did you say the University of Nebraska Health Centers?
Yes, and I put the source there in the presentation. So if someone wants to go through that in details, you're more than welcome to it. But this is very interesting, because at the beginning we were seeing, you know, the COVID is something that nobody knew how to really navigate. And we are being learning with time how to work around it. And it's still, you know, going through. I mean, it is a lot of things going on with that. So this study, I think I found this very interesting, because people think that, you know, using the neck, do you, Christopher, now you guys know the neck protector, that you put it like you put it on your neck when you're fishing, and then you put it on your face. It's a neck protector, right?
Yeah, I mean sunscreen, yeah, like a protector, yeah.
Kind of it. That the material that they have, it just actually do not do anything for protective for the virus. And it's being like very used, because obviously now the stores require masks or have your face cover, but it doesn't mean that you are actually protect anybody or you protect yourself from. So check this out. The tea towel. This material with one layer can give 83.2% of protection. If you do a double layer, you have 96.7, almost the same that you get with the N95 or higher. So
I have a question then, Gloria.
Yes.
Because I'm one of those people that like to wear my mask loosely because I feel claustrophobic. with these masks, their ability to protect you, does it need to be worn tightly around your nose and mouth, or can it be a little loose but still covering your nose and mouth? Do you know the answer to that question?
Yeah, usually you need something that cover tie, which means not a space in the side of your face, and
Okay.
and obviously cover up the nose. So if you use it under the nose, you're using it wrong. You need to protect your nose, so up your nose, and try to keep the mask as close to your cheeks as possible. It's not tied too hard that you cannot breathe, but it's important that you to understand that if it's all loose, it's airborne. It is air, so you can get more. But it all depends. If you're gonna be close to people, and this is important, if we're gonna be close and we're not gonna have any social distancing, you make sure your mask is correct, use. But if you're walking outside, nobody's around, you enjoy a park, you can actually relieve that stress of the mask. So be mindful, and I'm gonna explain a little bit about who can use it and how they use it, okay? So
Thank you.
let's keep it with, we heard from different medical resources that, you can do your own mask with a t-shirt, right? 100% cotton. Well, with one layer of that, you protect yourself 69%, and second layer, you protect 70%. With a scarf, only 62% with one layer, and it's no data that this increase the percentage if you use it like different layers, multiple layers. Pillowcases, the pillowcases material, they give you 61% and 62% increase if you put double layer on it. 58% with you use silk, and it's not data that show that increase any protection if you use multiple layer. So I hope this graphic, and I leave it that graphic for a while so you can actually take notes of what you need to use to do your mask, or what type of mask you can buy in the market, because now like everybody is selling masks with the team, with the corporate and all that, but it's important to know the material in order that. Now, if
I
you
had no
use it,
idea about the tea towel, so thank you for telling us. That's great information.
no, you're welcome. And you can put filters on that. And people that have the mask, they have filters, and they can have the coffee filters. They can have the air conditioner filters. But you need to be very careful of those, because you don't need to be unable to breathe. You need to be able to breathe, especially if you have any condition like asthma or others. If the materials that you use, you need to understand they need to be breathable. And yes, you want to protect yourself, but you don't want to limit your oxygen. You don't want to end in the ER because you don't breathe correctly and you don't have enough oxygen in your body.
And that is happening to people. So you're right.
Yeah.
People do need to be careful. Yes.
Yeah. So let's check the evidence for effectiveness of cloth face covering. So this is the, if you see the circle, everybody see the circle? You see all that
Yes.
is the air, the droplets. So you are protecting. That's the cloth barrier. Now, cloth face covering are recommended as simple barrier to help to prevent respiratory droplets from traveling into the air into other people's when people are wearing the cloth face covering when they cough, sneeze, talk, or raise their voice. This is called source control. So that's the way that the source of any illness is controlled. All right? And very important, but I will go that is how to clean it, right? Because you sneeze, cough, and you reuse it the next day, and reuse it the next day, and reuse it the next day, and never clean it. Hello, you're getting yourself in trouble. So the COVID-19 is spread mainly among people who are in close contact with another. That means that is within about 6 feet and less. So the use of the cloth faces covering is particularly important in settings where people are close to each other or where social distancing is difficult to maintain. That's when you use it in groceries, in grocery stores, and when you go to, I don't know, a restaurant, when you go into anywhere where you know there's a lot of people and you're not sure if you're going to be able to have enough space. This recommendation is based on what we know about the role of respiratory droplets play in the spread of the virus that caused COVID-19. And all this is emerging. Like I say, we are still working out with that. It's not that the last thing and you know this is it and this is it. No, they are still emerging evidence from clinical and laboratory studies, and that shows what we know until now, that definitely use the cloth barrier will reduce that. So check this example. In the first one, and let me explain to you the little colors there. So the size of the particles, right, is in different colors. So you will see there is particles that can be 100 and in particles that can be 0.1. So very, very small. So infectious aerosol particles can be released during breathing, speaking, and in any asymptomatic people that are walking and they don't know they're sick, they say, oh, I'm not sick and I'm not doing anything, I'm not coughing in anybody. But when you talk, they're actually send all that particles to the air. So that is what, you know, people get infected. Now, if you see the graphics here, someone that is infected and asymptomatic, you can see all the particles that that person is spread, right? And you're close to it. So if you are healthy, you using your mask, I'm using my mask, I'm not sick, but I'm still using it. I'm not getting contagious, you know, I'm not spread any virus because I'm healthy. But at the same time, if someone is not using the mask, you kind of protect yourself as well. So the maximum exposed is gonna be with someone that do not have any type of protection, and you're close to someone that is asymptomatic, that doesn't have any symptoms, but is spread a lot. Now, if you're using your mask and you are asymptomatic and you're infected, the droplets that you are sending is less. And you can see here. Everybody see? At least move your head and say yes. Okay, good. Yeah. I feel like I'm talking to myself and I'm talking to myself too much. So I need a little bit of face expressions there. Thank you. All right. So minimum exposed, and I hope that this helped to understand why it's so important to have this. Even
Gloria,
if you don't.
Gloria, could I interrupt and ask a question?
For sure, for sure.
The social distancing issue, maybe you're going to get into that later, but what are the current recommendations versus 6 feet or 12 feet? I'm hearing studies that say 6 feet doesn't really protect you that much, should be 12 feet a separation. And looking at your image there on the screen, are they actually recommending 12 feet to get the minimum exposure versus 6 feet?
Again, everything is under studies. A lot of things are being saying. Obviously, as far you are, as far that you can obviously be protected. However, yeah. I mean, 12 feet and 6 feet, I think that that's going to be related with what type of protections you have. If you don't have any protection, you you definitely need to be as far as you can.
Yeah.
If you have, but it's gonna depend a lot. It's gonna, a lot related to how you protect yourself. I think that's the thing. So I don't know. It is important that always keep updated with what is new and what we feel comfortable. Just give
I
me
think it's
one second.
also important to read, everything that you can about this and make sure that your response is based on rational logic and not just fear.
Right.
Because there's so much fear-driven information, and people sometimes I feel are needlessly fearful. I see people driving in their car alone with a mask, and it makes me sad for them because there's nothing in the car that can contaminate them, right? I run in a city park, and I pass a man who is so. He looks like he's come out of the hospital, and it's 95 degrees, and he's walking, and there's nothing that you can see on him right now except his eyes. And I feel so badly for him because I feel like he's making a decision based upon fear. So, I think we have to be very careful about and be rational and logical and read all the research and figure out what's best for us. Would you agree,
Again,
Gloria?
yes, I'm sorry to interrupt. Again, it's your level of comfortable. If you
Yeah.
level of, you feel that if you feel that you're protected, maybe for us, looking someone that is all covered up is like, oh my gosh, they suffer, but maybe they have underlying condition and they feel more protected.
Yeah.
So definitely, I think is level of comfortable, but as well, you need to understand that you need to be mindful with the breathing. If you're not breathing correctly, if you're feeling that your oxygen levels go down, because people are extremes are bad, right? So thank you for asking, Gerald. And I think I because I'm doing the presentation, I cannot see, but I think Chantel is online. So when I finish, I definitely allowed her to, because she isn't really the one who worked with this every single day, and she does our COVID test every 2 weeks to all our companies. So definitely she will have more input for it. So this is the consideration, is this is CDC, okay? And I always put the source of this information that I bring into. So a consideration for wearing cloth face. Recommends that people wear cloth face covering in public settings when around people who don't live in your, the people that don't live in your household, okay? Cloth face covering may help to prevent people have COVID-19 to spreading virus. So if someone is at home and is COVID-19 and they're asymptomatic, but they're COVID-19, right? They still, for protect the family, should use the cover. And cloth face covering, plus face covering should not be worn by children under age of 2 or anyone who has trouble breathing, is unconscious, incapacitated. That means if you're unconscious, please do not put a mask on someone that is unconscious, please. Or remove the mask if someone loses conscious. If you're incapacitated, if someone it's incapacitated and cannot remove the mask by themselves, don't put the mask on it, all right? It's very important that if you have someone that is incapacitated, that have issues with breathing, keep them, as much as possible out of risk, because it's gonna be very hard for them to use the mask. Now, how to wear a non-medical fabric mask safety. This is important. Some people need to understand that this is not only to please the grocery stores or the restaurants requirement. This is really for your health. And if you're not doing it correctly, you put yourself in a lot of risk to get sick. First of all, clean your hands before you touch in the mask. Inspect the mask for any damage. If it's have holes on it, it doesn't work anymore. So don't use it. Adjust the mask to your face without leaving gaps or sides. Here we go, Christopher. Don't use your loose face thing. It doesn't work.
Yes, ma'am.
Cover your mouth and nose and chin. Avoid touching the mask. Like if you're touching the mask all the time and you don't have your hands clean, well, you are put your mask in yourself in risk. Clean your hands before removing the mask. You now understand why using gloves are not that smart. Because every time that you touch it, you have something, you have to remove your gloves, right? So use your and clean your hands. Remove the mask from the straps behind your ears, not from the top of the mask. You don't touch the mask. You use the little straps. Put all the masks away from your face and have a bag for your clean mask and another bag for the dirty one. So if you use one and you do all your things use one bag and put it there. Then when you go back home, you remove the mask by the straps out of your bag and you wash it. It's better if you use detergent, soap or detergent. It's preferably if you use hot water. And please, it's one per day. No one for the entire month or that forever and ever without washing. And whenever you finish to clean your mask or you put it on the laundry, you wash your hands and please throw away the bag that you put your mask, your dirty mask, okay? It is a lot of work, right? But
well, thank you for saying that. That should be a public service announcement. That's great information.
I don't want to get anybody scared. Like, oh my gosh, now we're like have all this don'ts and do, and it's just like more work. It's just be mindful. Just clean your hands. Use your mask when you are around people, and you're not. Don't use it like for a week, and keep it in your car because if you forget, no, just bring it back. Have a clean bag. And that's it. It's just a little bit of change in your schedule, but in your help me, Christopher. I go blank. I will Spanish blank right here.
In your daily routine.
In your daily routine, you got it. But thank you, Christopher. Here we go.
Welcome.
This is the don'ts. Okay. If your mask is damaged, throw it away. Do not help. Loose mask doesn't work. If you know the strips needs to tie it a little bit, try to tie it in, but don't use it like that. Do not wear the mask under the nose. You see a lot of people doing that. It doesn't work. So please don't do it. Do not remove the mask where you're close to people. Say, oh, I don't have anything. Just let me remove it. You're my friend. I love you so much. I want to hug you and I want to talk to you close. And you remove your mask and 2 weeks later, you start feeling not that good. Do not use mask if you have difficult to breathe through. So maybe the material is too thick. The filter that you put make you sick. And if you're feeling like you're not breathing correctly, remove it. Maybe it's not the material that you should use. Do not wear a dirty or wet mask. If you're sneezing and coughing constantly to that mask, you need to remove that mask and wash it and use one clean because you're getting all that particles that will make you sick, more sick. So you remove that. And please do not share your mask. Oh, I forget my mask. Don't worry, use mine and I wait in the car. No, it's individual, okay? You need.
You know, Gloria, what you're telling me then is really a person should have maybe 2 to 3 little bags of mask every day, because there's so many times that our mask can become contaminated, or, you know, whatever these scenarios, we really need to have an extra couple of bags with us somewhere that we can get a mask that's really what you're talking about, the requirements. That's
Yes.
true, right?
It is true. It is true. And the mask is important. However, please remember, you know, stay home. If you feel sick, cough in a tissue and through the tissue. Please, when you cough and clean your nose, you don't save it. I know it's important for some people to save their own fluids, but do not do that. Just throw it away. Don't save the same tissue to reuse it. Just throw it away. Keep distancing. Clean frequently the touch objects, cell phones. We are just touching and put it on our face all the time. Our tablets, our computers, we need to clean it as well, like the same way that we do with our masks. Well, no, don't put it on the laundry or on a dryer. It's not gonna work. But if you wipe your phones, wash your hands, use hand sanitizer, and stay safe.
I just have I have a general question, Chris and Gloria, and I think it's an unanswerable question, but this whole social distancing and mask way of life, what do you see as the end result or the termination of all this? I realize it's an unanswerable question, but you know, I sense the numbers beginning to come down a little bit. I guess another way to ask the question is there an end to this tunnel?
You know, one thing that I would say to this, and I only one thing, because I'm not an expert, but the term social distancing actually concerns me. I think we need to physically distance, but we as human beings are very social, and we don't need to be socially distant at all. And I'm concerned about what some people are you know, I think we have to be so careful how we communicate what we're doing. And that's just one of my biggest concerns, especially for children, especially for young children, and especially for those who might be, you know, more infirm and are being socially distanced. Maybe we need to rethink that. We're keeping them physically distant, but how are we keeping them socially connected? Right. It's a very important distinction in my mind, and one that we all need to be aware.
Yeah, and Christopher, you nail it, because really what we need to understand is that physical distancing is necessary until we find out how to deal with this COVID. However, do not the fact that we are socials, we need to interact with each other. And that make another presentation, and actually next week is going to be about the stress management. And but having the opportunity to keep our connections, to do all this, I mean, it's never going to be the same, you know, and nothing is going to change the fact that you hug. I'm a hugger. I like to, you know, I don't know. I miss that part. But at the same time, but at the same time, I need to understand that we need to find out all the ways, and we need to, like I said during the presentation, you need actually to feel comfortable, respect what the authorities in this are, you know, saying and are recommended. And at the same time, you know, try to keep as much as possible your normal. And it's hard to talk about normal, because it's like, what is normal right now, right? It's like, what is? But I mean, we are blessed to have a beautiful, or live in a beautiful Florida. They have a lot of parks. They have a lot of options outdoors. Probably you have a backyard. And if you don't have a backyard with trees, you're probably gonna find a nice area with, you know, open space to go and just keep yourself active and try to reconnect through all that. So yeah, it is very, and it is very confusing as well, because sometimes, you know, at the beginning they say masks don't do anything, and then now it's like a requirement for everything. So be flexible as well. We need to learn how to be flexible as well, and understand that this is an illness, a disease that we are learning from every day. Every day is something like.
We appreciate both you guys for doing this for us and all that you do for us. It's a great relationship that we have, and we look forward to working with you in the future.